Tracy, did we put out enough chairs for everyone? Yeah? Okay, standing room only, I think. That's it. Okay, enough of the Zoom humor. Welcome, everyone. So glad to have you all join us. My name is Steve Staples. I'm the National Director of Policy and Advocacy for the Canadian Health Coalition. We're really excited to have you here. Amidst all the terrible things that are going on in the world, there are some things worth celebrating, and our healthcare system, now considering the context of what's happening in the US with the overturning of Roe v. Wade, just makes us cherish this system with all its warts and flaws as much as we ever had, and makes us recommitted to make it even better all the more, given all of the situations that we find ourselves, the crisis that we find ourselves in the room. I'm going to begin with a land acknowledgement to start us off. So the Canadian Health Coalition is based in Ottawa, and we pay respect to the Algonquin people, who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region from all nations across Canada who call Ottawa home. We acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders, past, present, and future. So I'll begin by just saying a little bit of word. I know lots of you have probably been longtime supporters of the Canadian Health Coalition, founded in 1979, one of the longest established nonprofit civil society organizations committed to protecting and defending and expanding our public healthcare system. I mean, it even predates the Canada Health Act with its 5 principles, which we uphold even today. And in fact, it was the CHC played a key role in bringing the Canada Health Act in 1984. But of course, healthcare goes back even further than that. And that's what we're going to talk about. The 60th anniversary of the founding of what we've come to know as Medicare in Saskatchewan on January 1st, 1962, 60 years. And of course, within 10 years, every province and territory in the country was covered by the same kind of Medicare system, which was a huge success and has helped define and shape our country. So I'm really excited that tonight we've got some really extra special people that are going to tell us the story of how we got Medicare, because we know that everything that we win today is such a hard fought battle, and it was no different than it was no different back then than it is today. And in fact, in reading the story and listening to our speaker, Nicole O'Byrne, who's going to be telling us the story tonight, there's so many parallels from then to today. You're going to be amazed. So I'm really looking forward to this great presentation with lots of archival footage and anecdotes, and I'm looking forward to that. Tracy Glynn is our operator machine person tonight, who's keeping us all on the air and will be handling all the questions and things that are coming in. So if you've got some questions, jot them down, and we're going to have a question and answer period at the end. But first, I want to introduce Anne Legacy-Dowson, who is going to be our host. Anne is an award-winning radio host and journalist and former host of CBC Radio 1's Radio Noon in Quebec, and former guest host and producer of CBC's flagship programs, few of which you may recognize, Cross Country Checkup being one, and As It Happens. And she's a frequent commentator on Radio Canada and Bell Media. And Anne is wonderfully fluently bilingual and holds a master's degree in Canadian Studies. Anne, I'm handing it over to you.
Merci, cher Steve, et merci à tous et toutes d'être là ce soir pour fêter le 60e anniversaire de l'assurance maladie du Québec et du Canada. Thanks very much to Steve and to Tracy for being such excellent co-workers. And it's such a pleasure for me to be introducing our two guests who are phenomenally talented, wonderful leaders, each in their own respective fields. So I'm hoping that we can manage to celebrate, despite some of the bad news that Steve just alluded to, Roe versus Wade being thrown out. The news is up and down on healthcare. There was just a survey that said that the majority of people polled by Angus Reid have lost confidence in the province's ability to deliver healthcare. We saw the head of the Canadian Medical Association calling the system on the verge of collapse. She, of course, walked back some of that after she said that. But so there's, many, many different discussions going on about this beloved program, which I think many people would say is what characterizes Canada. It is one of the things that defines us. And one of the reasons why many people admire Canada is because we've managed to pull this program together when the United States has never been able to do it. So without any further ado, I'm just going to introduce our two speakers. And it gives me great pleasure to present to you Nicole O'Byrne, who is an associate professor of law at the University of New Brunswick. She's originally from Saskatchewan, and she did her PhD at the University of Victoria. She does research which focuses on the history of Canadian federalism and intergovernmental agreements, including Medicare. And she's co-authored a number of important scholarly works, among others with Greg Marchidon, the executive director of the Royal Commission on the Future of Healthcare in Canada, on the history of Medicare. She's doing work on the history of Medicare in Nova Scotia and Newfoundland at the moment. And before joining the UNB's law faculty, she clerked at the Saskatchewan Court of Appeal and was a member of the Saskatchewan Bar. And joining her is Pauline Worsfold, our beloved chair of the Canadian Health Coalition. She is also a registered nurse in the post-anesthetic recovery room at a hospital in Edmonton, Alberta. So between being a frontline nurse through the pandemic, she has also been the chair of the Canadian Health Coalition. So I think that makes Pauline a folk hero or something. I'm not sure. Anyway, so she's currently the chair. She's also the secretary treasurer of the 200,000 strong Canadian Federation of Nurses Unions, the CFNU, a position she was first elected to in 2001. And Pauline has received many awards for her commitment and contributions to the community and her union in Alberta, the United Nurses of Alberta. So we're going to start with Nicole, who has a very beautiful Indigenous design behind her, and she's going to give us some of the really interesting history, which in some ways parallels what we're dealing with today. So I'm going to throw it to you, Nicole.
Great. Hi, everyone. Yeah, I decided I better put up a Willistic River background here because we were introduced as being welcome to Algonquin territory, but I wanted to tell you that I'm in Wolastoqiyik territory here in the lands of the Wabanaki, or otherwise known as New Brunswick. So we're the land of the Willistic River, the beautiful and bountiful river. So because of Zoom, we can come from all sorts of different territories in this country, and I think that's very fascinating. So I'm going to share my screen here, and we'll get into the slides. Here we go. Okay, this is us. All right, folks, Medicare, the defining domestic policy issue of the 1960s, and I would now argue today, if COVID has done anything, it has, I think, reminded us of the precarity of healthcare, but the importance of healthcare, and what it does define our national character, and that we have to constantly think about it, reinforce it, and be thankful for it. But it did not fall from the sky. It came out of decades of struggle, of people going bankrupt because they couldn't afford healthcare. Tommy Douglas there on the right, who was Premier of Saskatchewan, when he was young, he had a very, very serious health condition. A doctor performed surgery on him pro bono, and then he was able to walk regularly and participate in sports. And he never forgot that. He never forgot that. It was one of the motivating factors for him going into politics. So let's talk about Medicare, though. Is it a revolutionary idea, or is it an evolutionary idea? And of course, I'm going to say it's both. But the revolutionary part of the Medicare idea is that you get health service on your basis of need, not on your ability to pay. And we see the counterexample in the United States. But there was a template coming out of World War II. They moved into rent agreements and whatnot between the federal and provincial governments. So you have to pay for all these things, right? And so the first tentative steps into universal healthcare was hospital coverage, so that you didn't have to pay for hospital care or medications that you were prescribed by a doctor while in hospital. Medicare was an evolution of that idea. So it was revolutionary and evolutionary at the same time, because it was an extension of healthcare services to a larger basket that we call medical care or Medicare. So the idea of Medicare, now this story is, I think it's apocryphal. I like to think it's true. We have John Diefenbaker. These are both Saskatchewan boys. The story is that they were in the Saskatchewan Legislative Library hanging out. And of course, John Diefenbaker, who was a red Tory, and Tommy Douglas, of course, as we know, was a CCFer, and which is a precursor to the NDP. Now, I know the Liberals like to take a lot of credit for Medicare, but the idea really came out of a coalition of people who just thought that this would be the right thing for people. So the conversation in the law library, or the legislative library, that supposedly happened was John Diefenbaker said to Tommy Douglas, "I think we can do this. I'll appoint a royal commission, and I'll put my law school classmate," he and Emmett Hall, John Diefenbaker and Emmett Hall graduated from the same class in the University of Saskatchewan College of Law in 1919. So Emmett Hall, whose biography, the title is Establishment Radical, he was no CCFer, he was another red Tory, but for several years, he heard evidence and submissions from all across the country about what we needed to improve health services. And of course, out of the Hall Commission report, we get Medicare. And when the report came out, Alan Blakeney, who became a premier of Saskatchewan, just passed away recently, said it was a blanket endorsement of CCF policy. And of course, the CCF idea of Medicare is that it's a single payer system, so that the funding for it comes out of general revenue. There aren't user fees and that kind of thing. So it's a single payer system. That's the CCF model. That was eventually taken up by the federal government. That's a big, long story, but essentially the Saskatchewan model is what kind of carried the day. Now, John Crosbie was Minister of Health in Newfoundland at the relevant time, and he said, Medicare is the trappings of an elephant on the back of a mouse. Now, what he meant by that was, great, the feds will give cost-sharing dollars to the provinces to implement and administer Medicare, but they've got to build the government apparatus to do it. And there was bureaucracy that was needed to see this kind of program, because as you can imagine, it's the biggest social program ever undertaken in Canadian history. And smaller provinces such as Newfoundland or New Brunswick or Manitoba often didn't have the apparatus to even deal with the funding that they were going to get from the federal government. And some of the provinces, to even get Medicare going, it wasn't just a 50-50 cost share dollar. Newfoundland got 92 cents on the dollar from the federal government just to get it going. New Brunswick was 87 cents on the dollar. We now, you can see the funding has dropped precipitously from the federal government, and that's one of the problems we can talk about later. Okay, now, organized medicine. They were very uncomfortable, and I'm going to show you a video from the Saskatchewan doctor strike, but they were very nervous about it. They thought they would lose control over their practice, that the government would be telling them how to practice, that there'd be other levels of bureaucracy. And as you see in this cartoon here, there's, you know, the girls in the office, forgive the phrase, but are saying, oh, well, come back here and fill forms. And the doctor's like, well, I just actually want to serve my patients, right? So there was that tension right from the get-go, and the Canadian Medical Association lobbied, along with all its provincial counterparts, to oppose Medicare as we now know it. And here we have a doctor, okay, and this is George and his dragon. And of course, the dragon is government interference. And again, doctors were primarily concerned about a loss of autonomy in their own practice, because they are really more akin to small business owners and entrepreneurs than anything else, okay? So we get the Saskatchewan doctor strike. Medicare, the Saskatchewan did not want to wait for the federal government to get its act together. They went ahead alone in July of 1962, which is the anniversary we're marking this evening. And the doctors resisted it to the point where they're like, well, if this is going to be thrust upon us by a socialist government, we'll organize and we'll go on strike. Okay, so they took on kind of a labor union kind of organization and decided to go on strike. And I'm going to show you a couple cartoons here, and then we're going to watch a video. And I apologize for the sound on the video. It's a little bit distorted, but 6 minutes and it's really amazing. But here you can see a cartoon that has Tommy Douglas as a pirate, right? Walking the Saskatchewan doctors off the gangplank, except it looks like Douglas is going to be the one that's, you know, going to end up in the ocean, right? And then, of course, the other cartoon says Saskatchewan doctors reject the government medical care plan. And boy, did they ever. Okay, on that note, let's watch a short video here. There we go. Okay.
Canadians regularly say that one of the things they like best about their country is its universal medical care. But Medicare was not inevitable. In fact, it almost didn't get started at all. Then in 1944, Saskatchewan elects the first socialist government in North America. The party is the Cooperative Commonwealth Federation, the CCF. The new premier is T.C. Douglas, known to most as just Tommy. As premier, Douglas takes the health portfolio himself and goes to work.
Say to you, you need a surgeon or you need a specialist, and you will choose the surgeon and you will choose the specialist.
A confident Douglas announces his Medicare plan and calls an election on it.
The government proposes to introduce a province-wide prepaid medical care program that will supply medical services to every citizen in the province.
The doctors of the province fear the plan will curb their economic freedom and kill their own private insurance plans. But Douglas and the men of the CCF are not concerned with the doctors' fears. The election of 1960 is fought over one issue, Medicare. Ross Thatcher, Liberal Party leader, is Douglas's main opponent. Most of the doctors get behind Thatcher, who it is said campaigns like a charging bull. But if Thatcher is a bull, Douglas is a matador. The doctors call the CCF communists and say the plan could create a future where doctors are like slaves. Menopausal women can be sent to mental institutions and Catholic hospitals must perform abortions. June 8th, the CCF wins the election handily, with 40% of the vote and 38 of 54 seats. Douglas appoints a commission to design the plan. Impatient with its squabbling, he uses an interim report to draft the legislation. It is quickly passed in November 1961 and set to go into effect the following year.
They came to power with a vast majority, and then they started throwing their weight around as though they were complete communists.
Thinking his lifelong goal of universal medical care has been achieved in Saskatchewan, Douglas resigns as premier in order to lead the newly formed and national New Democratic Party. But back home, there is a political storm growing, and the man whom Douglas has left behind to face it is the new Premier Woodrow S. Lloyd. Doctors now threaten that if the government goes ahead, they will leave the province en masse. April, the doctors make a counter-proposal. Instead of Medicare, their private insurance schemes would remain. For those who can prove they're too poor to afford the premiums, the province could provide subsidies. Premier Lloyd rejects the proposal, and doctors begin to leave the province, many for the United States. Those who remain are talking strike. May 3rd, doctors attend an emotionally charged rally in Regina. Premier Lloyd walks into the Lion's Den to appeal to the doctors directly. It does not go well. The moment Lloyd sits down, someone calls for a vote. The doctors overwhelmingly support a strike, a left-wing tactic against a left-wing government. The walkout is set for the day the act becomes law, July 1st. Some people get angry with the doctors. Others blame Premier Lloyd and Douglas. The doctors have a problem. If the strike is to work, they have to withhold treatment, but they feel they can't let patients die. Premier Lloyd makes a last-ditch attempt to head off the strike. He says that the doctors can opt out of the act, but they're confident they can force him to cancel it completely. The strike will go forward. At 1 minute past midnight on July 1st, 1962, Medicare becomes law. The doctors go on strike, and Saskatchewan's healthcare system shuts down. The government advertises internationally for replacement doctors. Lloyd has no trouble attracting doctors. Over 100 arrive, most of them from Britain. But the foreign doctors can't replace all the strikers, and their arrival doesn't calm the fear and frustration.
Here's my situation. I have a family of 5 little girls. One girl is suffering from cerebral palsy. We have a specialist in Saskatoon, which is second to none in the North American continent. Now you tell me, sir, when this specialist leave, which he no doubt will leave because he has no alternative, where will I take my daughter? To Montreal? Will the government pay me transportation? Where will I go? Tell me.
But, sir, this is not the issue.
This is the issue. This is my issue. This is the people's issue.
Groups called Keep Our Doctors Committees spring up all over the province to support the strike. One KOD is started by some Regina mothers over coffee.
You know, the thing that worries me about this, I'm beginning to feel like a cornered rat. The people have requested a delay in this plan, and we've done everything we possibly can do. We can't do any more, and our doctors are leaving.
Whether spontaneous or orchestrated, the KOD's campaign soon gathers momentum. One of the targets of the protests is the foreign doctors.
The first time I have ever been frightened or realized the power of some oratory. I'm sure if I had suggested, after listening to some of the other speakers, if I had suggested that people go out and get their guns and deal with the legislation in that fashion, they'd have done it. It frightened me.
Vigilante groups now threaten violence on both sides.
I got a letter one day telling me I was going to be killed if we didn't cancel this, and so did Woodrow. So I took the 10 gauge. I put 3 shells in there at nighttime when I went to bed.
But the doctors and the KODs have planned a giant rally outside the legislature in Regina. Premier Lloyd knows that if the doctors can muster a massive show of public support, the strike might succeed. And the first Medicare plan in Canada will be finished before it gets started.
Okay. I think that video gives you a sense of how high the stakes were. Death threats and talking about having rifles ready and whatnot. So, you know, Medicare has always been controversial. We've seen the recent debates in the US and whatnot, but Canada, we sometimes forget our history, but it was controversial and hard fought to be implemented in the first place. I'm going to tell a little bit about that story here. The essential debate over Medicare was this: do we go ahead when we don't have the money or the cost sharing formulas in place? Or do we wait until, and this cartoon says build the patient up first, do we wait until we've got the right financial conditions so that we can pay for everything? And I'll tell you, every finance minister probably in the history of the country has always said there's not enough money for Medicare, right? Like there's never enough money. There's never been enough money. We continually hear about the cost challenges for providing this kind of service. But that was to get it off the ground. Was the federal government was like, how do we actually fund this? How do we especially deal with the provinces like Newfoundland and New Brunswick, where cost sharing at a 50-50 level is just not going to work? It's not going to be enough money for them to set up the administrative and bureaucratic infrastructure to deliver the program, never mind attract the more doctors you're going to need, because now that people don't have to pay or mortgage their house to get care, there was a built-up demand for care. So everybody was predicting that doctors, we'd need about 20 to 30% more doctors to deal with the backup in need that had built up to this point. So negotiations began in 1965 in the wake of the Royal Commission. Judy LaMarche, if you know anything about her, I don't think it was very fun to be a female cabinet minister in the 1960s, yet this was her file. She was handed Medicare and she got made fun of in the press and whatnot, but she was a true believer and she did a lot to put the this on the cabinet agenda and fight back against some of the people, some of the liberals especially, who believed in Medicare but didn't think they could ever finance it. We get the Federal Medical Care Act of 1966. This is the federal legislation. Now, this is a fantastic and just absolutely ingenious piece of legislation, because what it does is it says to the provinces, which we all know Alberta is not the same as Newfoundland, which is not the same as Nova Scotia. But what it said was, if you want the cost sharing dollars that we will provide, and like I said, in Newfoundland's case, it was over 90% of the cost, you will adhere to the principles that we set. Okay, so like the little toes in the cartoon, if the provinces wanted the money, they had to live up to these principles, and they were, it had to be publicly administered, universally accessible, comprehensive in services, and then portable from province to province, so you carry the benefit with you no matter where you lived. If you could live up to those principles, then you'd get the federal dollars, and that is a great way to ensure compliance. So implementation was based on provincial readiness with respect to cost and the administration needed to deliver the services. And this is the Saskatchewan model, where it came from general revenue and not based on a multi-payer system, but a single payer, that being government revenue. Okay. This, of course, the 1960s is the storied era of cooperative federalism. So there's kind of a mythology out there that all these negotiations went, they had a lot of nice lobster dinners and hung out. Well, it was more scrappy than that, with the provinces trying to get better terms. At this cartoon says New Brunswick has said no, because what the federal government was offering for cost sharing dollars was not going to be enough money for New Brunswick to actually set up the program. So they said at some point, we support it in principle, but we still can't do it. So there was a lot of back and forth there on the financial terms. The 50% cost sharing was a really tough sell in the poorer provinces. It just wasn't going to work. So now here's another cartoon that says your Medicare, and this is of course Prime Minister Pearson in the middle, and then getting checked out by all these doctors. Your Medicare doesn't sound so good. So even though there was the legislation in place, the federal legislation, there was a lot of support for Medicare. Throughout the late 60s, it still didn't look, it was very unwieldy. There was still a lot of resistance within the federal cabinet. A lot of people very nervous about how they could ever make it go. So it was not even a done deal at this point. But the people wanted Medicare. Okay, so this cartoon says, well, here you are, sir. Nobody wants Medicare, but the people want it. The citizens of this country wanted Medicare. And they wrote letters and to their MPs and to their local politicians saying, we want this, we need it. And one of the more eloquent letters I found in the archive says, look, if we could organize to beat Hitler, surely we can organize to beat measles, or what other, what other problems, right? So let's do this as a country, right? So there was just overwhelming support from civil society, and we still see that, right? Medicare is so baked into our national character, and we take it, I think, maybe a little bit for granted, but people really wanted it. So they were really pushing the politicians to make these deals work. And ideally, it was supposed to be our big Confederation moment. Medicare was supposed to be implemented July 1, 1967, to celebrate 100 years of nationhood. Well, it didn't quite make it. It started clicking in 1968 in various provinces, but this was the original goal. So provincial Medicare implementation, here's some dates for you. Saskatchewan and BC are right off the block, ready to go, July 1968. Not surprising, because Saskatchewan had already implemented its plan 6 years earlier. British Columbia, the premier of the time was a gentleman named W.A.C. Bennett. He was certainly no CCFer. He did not believe in socialism anything. He was totally on the other side of the political spectrum. However, he saw Medicare as helping build up a healthy workforce. Thus, you can attract more industry to British Columbia. So he was in support of Medicare as well. So a lot of principles and policies and politicians all aligned behind Medicare for various reasons, and all the provinces eventually came on board, New Brunswick being the last one in 1971. Now here's a little advertisement. This is my older brother, Greg Marshallton, And with my mom, she was a nurse's aide in Carrot River, Saskatchewan during the doctor strike in 1962. She was a single mom. My brother was 4 or 5 years old at that time. And of course, here come some of the doctors from the UK to replace the doctors that she used to work with who'd gone to the States. And they were told as nurses' aides and nurses to not talk about the politics of Medicare at work. This was a verboten subject. And yet, when asked, Mom said, but I thought it was a good idea because my son could get the care he needed. So that's the story of our family about why we care so much about Medicare. My brother became the director of the Romano Commission. And then of course I have to plug one of his many books on Medicare. We have articles and things. It's called Making Medicare. It came out a few years ago. He's currently working on the history of Medicare in Canada. I think it's going to be 500 or 600 pages. He's trying to get it done by the end of the year here, but he has spent the last 20 odd years on this. It is so important that we continue to fight for Medicare and to know these stories about where it came from so that we don't rest on our laurels and just take it for granted, but that we know that the fight continues, but for the greater good, for the benefit of all. And the most important principle being healthcare on the basis of need and not on the ability to pay. That's what makes us Canadians. We care for one another, and Medicare is a manifestation of that caring. So with that, I think I've gone a little bit over time here. I'll stop sharing and we'll move on to the next segment.
Thank you very much, Nicole. It's pretty thrilling to see some of the history and how fraught it was. And it's sort of reminiscent of some scenes we've seen recently in Ottawa, as recently as February, how pitched the ideological battle has been. So I'm going to ask Pauline Worsfold to jump in and maybe just start off by telling us your reaction to seeing some of that footage and seeing some of those images. Pauline, what comes to your mind when you see some of that stuff?
I just had to wait to be unmuted.
Oh, okay. All right, well, please jump in.
Okay, thank you. I guess what I'm struck by is not only the amazing footage, but the amazing orator that Tommy Douglas was. And of course, we on this call probably remember a few years ago, they had the greatest Canadian vote, and over 1 million people voted in favor of Tommy Douglas, and he beat out some pretty high profile people, including Terry Fox and Pierre Elliott Trudeau, and was voted #1 greatest Canadian ever in the history of Canada so far, right? And the other thing I'm struck by too is the parallel that we seem to be at right now, that currently we have a partnership agreement between the NDP and the Liberal government, and that happened in the 60s, the collaboration in the 60s. We had provinces by provinces agreeing to, currently we have them agreeing to dental care. Back then, we had them agreeing to some type of medical payment scheme, that sort of thing. And I really, truly feel very optimistic that we are on the precipice of getting something big. And what I'm talking about is a national public drug plan, a pharmacare plan for everybody who lives in Canada. Earlier, Anne mentioned a poll that suggested that people are not happy with the way provinces are being dealing with healthcare and the delivery of healthcare in each individual province. And we also have another poll up our sleeve that says 89% of Canadians are in favor of a national public drug plan, a pharmacare plan. So the naysayers to that, what do they say? There's not enough money. Same thing that they said in the 60s. But even our own parliamentary budget office said it would be a modest savings of 2 to 3 billion with a B dollars to the system that we have now. And other learned people have said it could be upwards to $11 billion in savings that we could have. So just imagine $11 billion in savings for what we could do with that in the healthcare system. We could create more long-term care beds, not for profit. Get the profit out of there right now. Let's just put that on the table. We could have more home care visits. We could have more infrastructure to support people staying in their homes rather than having to access the healthcare system. We could have more mental health supports. I could go on and on. As a registered nurse for 41 years, I've seen everything. I've seen improvements, I've seen successes, I've seen failures, and the people that suffer are the patients. And these days, because of the pandemic, the people in the system, whether it's registered nurses, licensed practical nurses, psychiatric nurses, physicians, lab techs, x-ray techs. I mean, I could go on, right? Everybody in the system right now is suffering, whether it's moral distress from not being able to deliver the care that they want to deliver, or personal stress, work-related stress, burnout, et cetera, and people are leaving. Not only nurses, people are leaving in droves because they just can't take it anymore. So imagine if we were to be able to save $11 billion and put it back into healthcare, that could make huge, huge improvements to the system overall. That was a very soapboxy answer, was it? But I just, you know, I'm very passionate about this. Have been for a number of years, obviously, and it can be done. And we have to overcome the naysayers. In the 60s, it was the doctors and the insurance companies. And today, it's the pharmaceutical companies and the lobbyists. You know, follow the money. The money always tells the story. Follow the number of meetings that the members of parliament are having with the drug company lobbyists, as opposed to the Canadian Health Coalition, who can't even get a meeting with the Minister of Health, the federal Minister of Health. So, you know, we need everybody on this call to bring pharmacare to the forefront. So in addition to that, we need national long-term care standards. So it doesn't matter where you live, that you're going to be covered by a patient's rights, Bill of Rights, something like that. That's going to ensure that it doesn't matter if you're in the Yukon or the Northwest Territories or in Alberta or in Nova Scotia, that you will be able to access long-term care to support your needs that are required to keep you healthy and safe and get the profit out of that long-term care. That's 100% there. So, I'm just glancing at a couple of the questions there. Yes, I agree. Mental health and addictions, huge right now. So part of that cost savings, and I'm not, you know, people tell me I have rose-colored glasses, but it's going to cost us money to set up a pharmacare program. I fully admit that. But in the end, it will not only save lives, but it'll save money too. Sorry, Anne, you were going to say.
I was just going to say, I think it's time to for Steve to jump in, and then we're going to open it up and deal with the questions, and maybe both you and Nicole can address some of the questions that have popped up in the chat. And I have a few questions too. So there's so much to talk about, and I can hear the passion in Pauline's voice and in Nicole's too. And I find it really heartwarming. And I just want to mention that I think some of it has to do with the vocation of nursing. My eldest daughter is in nursing. She's in her second year of a college program in nursing, and she has the same passion it's a great thing to see, and it's a great thing to be part of. So I'm going to invite Steve Staples to join us again, and then we'll go right back into the questions in a more focused way. Are you with us, Steve?
I'm here. Thanks, Anne. That was so awesome. And I just loved Nicole's presentation, and Pauline's remarks afterwards absolutely struck home, particularly about the situation and this deal between the Liberals and the NDP that's promising, you know, national pharmacare, a safe long-term care act, things that we've campaigned for, as Pauline mentioned, big investments to deal with the staffing crisis and the mental health issues and all kinds of other issues that are contained in there, or that are needed in our healthcare system as well. So many important issues. We've got 3 years to work on this, and we need everybody to join up, to combine resources and to help us move this forward. As I mentioned, I've been here a little over a year. We're so excited to have Tracy Glynn join us as the National Director of Operations and Projects, and also Anne Legacy Dowson as our media director. The organization has been growing. We've been adding new members, and I want you to connect with us. So I've got three things that I'd like to invite you to do. The first thing is to like us on Facebook, or if you're a Twitter person, please follow us on Twitter. And Tracy's been posting the links into the chat, so you can just click on those, the Facebook and the Twitter, so you can stay connected with us. The second thing is we do a newsletter every Wednesday in English, every Wednesday afternoon at 5 p.m. Eastern. So you get the latest news and perspectives and stuff that's happening in the coalition, and the provincial coalition stuff is in there, and what's happening in Ottawa. So if you register on our website, just plunk in your email address and you'll get the English newsletter every Wednesday. We also have a French one on Friday as well too. If you flip over to the French side of the website and sign up there, you can get the French one on Thursday. And they're different. They're somewhat different. They're not exactly translations. They're a little bit different. So that's the second one. And the third one is to consider becoming a supporter of the Canadian Health Coalition. And if you already are, thank you so much. We're trying to ramp up now that we've got these awesome team people in place to really move forward with this opportunity that we've got for the next 3 years for this confidence and supply agreement between the NDP and the Liberals. And consider, if you can afford it, make your first or an extra special contribution. I know many of you are already donors because I see you, I know your names very well, and some of you I know personally. So thank you very much. But if you're not, come on board and make a contribution to our campaign and be part of the solution. So I'm going to send it back to Anne, because I think we've had some amazing questions. I love somebody who noted the living history and living memory of these struggles that's on the call tonight. So I thought that was really cool. So Anne, I'll send it back to you for some discussion.
Thank you very much, Steve. So I see in the chat somebody, Brian Stokes, saying in Ontario, the plan is to starve the system to bring public dismay and then move to private entities. And I have to agree. I think that seems to be the logic that we're seeing in places like Ontario, and to some extent, large extent actually, in Quebec. So I wondered if both of our speakers could address that phenomenon, which I think is possibly quite deliberate, probably quite deliberate. So do you want to jump in, Pauline, and then maybe you can jump into Nicole on that?
I couldn't agree more with the comment, and it's not only specific to Ontario, but it's all across, including in Alberta, where I work. And, you know, we all know if you starve the public system and, you know, say that it's really bad and it's going to get worse, like Eeyore and Winnie the Pooh, people start to believe you, and they do see it. And yes, there are wait times are exponential, but let's not forget we cut back so much in the 90s as far as funding of healthcare. And you know, the nurses unions across this country have been sounding that, pounding that drum for the last decade or two about, if we don't watch out, we're going to be in terrible situation in 10 or 20 years from now, which was 10 or 20 years ago. And it's come to fruition. But one thing I'll say to the people on the webinar, and please tell your friends though, the people that are remaining in the system are working so hard to meet the needs of the people, the patients, residents, and clients that are accessing healthcare. And we are doing our best. And, you know, I saw a sign at a cafe the other day, and it says, the whole world is short-staffed. Please be kind to those of us who show up. And that never a truer word is spoken. But I'm here to tell you that if you need the system in an emergency situation, you walk into the emergency department with a little small child like my granddaughter, and a week later, my grandson, and they have broken arms, then you're going to get care and attention immediately. You're not going to be turned away. You walk in with a heart attack, you're going to get care and attention immediately. So the system as it is, fraught with wait times and troubles, is still there. It's still there for you. And the people that are staffing their residents, patients, and clients will get the care that they need.
Nicole?
Yeah, well, when you talk about money, you're really talking about political will, because there's always money. I mean, this whole argument that the austerity dialogue, we know is as much of a myth as anything else, okay? And we've seen the federal government in recent years come up with billions of dollars to buy pipelines and whatnot. So there's money. It's just priorities. And so how they respond to political pressure. And what we saw in the 1960s, which I think we're starting to see a little parallel here, is that the Pearson government in the 60s was minority government. They needed the support of the NDP. The NDP pushed them a little bit. The CCFers from Saskatchewan, Tommy Douglas primarily among them, had gone to Ottawa for this bigger fight, right? He's like, Saskatchewan's under control. I'm going to Ottawa to do this. And that was the game, right? So when things come into coalition and you start to build alliances, things can start to move. And so what we've seen here with the NDP and Liberal, maybe I'm an optimist here the last while, is that the Liberals want the support of the NDP to avoid going back to the polls. They're worried about how that will end up. And so we've got a moment here, I think, in time. The other thing to say too is the Hall Commission that reported in 1964. I think Emmett Hall and I think all the people involved in that Royal Commission would be appalled to know that what they recommended, it never got fully implemented, again because of the dollars and cents. But it was supposed to include all sorts of other services, including maybe optometry, more mental health care. It wasn't supposed to be as limited. It was supposed to keep growing. That was just the start. And what happened in Canada is things just kind of got stuck and kind of stagnant. So maybe we've got an opportunity here with pharmacare and whatnot to get unstuck and keep this thing growing and moving and showing what a real benefit is, to get back to the dollars and cents. The other thing too, we saw the resistance of organized medicine all throughout. They had their own medical insurance plans. It's what we now recognize as Obamacare, right? So it's a private insurance. It was run by the doctors themselves here in Canada. But then if you couldn't afford it, you could get subsidized by the government. Well, general revenue and single payer kind of got rid of all that because it's really expensive to administer programs like that, where some people qualify and some people don't. There's tons of paperwork, and that's where all the money goes, right? Is to running the elaborate infrastructure that you need for complicated programs like that. So we saw the doctors come on board, and here was the winning argument for the doctors. They had a lot of patients, and because of the Hippocratic Oath, they felt obligated to see, but that they never got paid. Okay, and you hear stories about doctors working during the Depression and getting a chicken in payment or whatever. Well, what happened with Medicare is that they got guaranteed payment because the government was paying them. So their salaries went up. Like between the late 1960s and the mid 1970s, the average doctor's salary went up about 30%. So the people who were dead set against Medicare saw that, geez, they didn't have to chase individual patients down for payment. their actual administration went down because the government was doing that. They were actually freer to practice medicine and they got paid more. Win, win, win. So we're in a situation right now where I think we can see that we need a healthy workforce. I guess COVID is teaching us some lessons here, that we need healthcare just so we can operate the economy the way that it's built to operate. We actually need a healthy labor force to do that. So I'm not sure, like, to say that it comes back to money and political will and kind of trying to bring these alliances. I am a hopeless optimist, I guess, but I think there is a moment happening here where we can do that. I mean, Medicare and hospitalization came out of the planning out of Reconstruction from World War II. If we can plan for war, we can plan for peace. That's where our social programs came from, was that shift in mentality that came out of World War II. COVID, I would argue, and again, I'm being maybe hopelessly optimistic here, but we've got to come out of this pandemic thinking differently. What else is it going to take? And I think we're going to see something very different here happen. It will devolve into profit motive and the sharks taking their cut or whatnot, or we move it a different way and we see cooperation, bringing things together, making sure people's interests align, and then growing and building a program that honestly has saved thousands of lives over the last couple of years. I better leave it there because I'm a professor. Don't give me room to talk.
So I'm going to jump in and take a question out of the chat, and I would ask people to put their questions in or their comments because the chat is pretty rich, as was mentioned earlier. So this is from Pat Van Horn, one of our colleagues actually, but it's right on the topic. How do we continue to promote public health and healthcare and our system while constantly criticizing it for its failings? Are we unwittingly making the case possibly for privatization? So how do we galvanize, and I would add to Pat's question, how do we galvanize younger people who don't know the story of the doctors' strike, don't understand how ferocious the opposition was, and how how many vested interests are behind the scenes pressuring to dismantle the system? So I guess that's a double question, but I wonder if you wouldn't take a stab at it, Pauline.
Well, like I said, we have to say that, with all the health human resource issues, that the system is still there and it's still working and we're doing our best. And we do have to celebrate successes that have happened across the country, whether it's a small pocket in New Brunswick or the Alberta Hip and Knee Clinic here in the province of Alberta that have had success, shortening wait times and that sort of those kind of measurable things. I do think we do a disservice to ourselves by saying that the system is collapsing and that, but those are the words that journalists grab onto for the story. And what about the good news stories? What about patients that were able to get their surgeries because we used innovative methods and we turned our day surgery into a one-night sleepover type situation? So, if you didn't meet the criteria, you didn't have to go home. You could have one night in the hospital, but you needed to go home the next day, So we have had successes and we need to celebrate those and share them across the country as far as what worked well. We have to also stop these trial situations or pilot projects and only give them money for short periods of time, because if they're hugely successful, we should be touting them across the country to better the healthcare system overall. And, as far as the issue itself, it's the people's issue. That's what I picked up when Nicole, during her presentation, the reason why Medicare was successful in the beginning is because it was a people's issue. So we have to make it a people's issue again. We can't let the privateers and the profiteers be running the show. We have to say no, and we have to take it back. by telling our good stories, sharing our successes, and we have to prop up the system that we've got now until we can make it better.
Nicole?
Yeah, so on that slide where I showed all the provinces coming on one by one, and Saskatchewan and BC were first to jump on board in 1968. Now, what happened in other provinces was they said, your federal tax dollars are going to pay for people's Medicare in Saskatchewan and BC. How do you feel about that, Newfoundlander or someone living in New Brunswick? So your federal tax dollars are going somewhere else and you're not getting a benefit of the program. That's what knocked down the resistance to Medicare spreading across the country, okay? Now, when the feds are putting in over 90% of the money to get Newfoundland going and over 87% to get New Brunswick going, and the feds have now vacated the space unconscionably over the last 4 or 5 decades to, you know, and there's lots of debates over the numbers, but they're down to 15-20%, right? And so you've got provinces saying, well, maybe it's time for more private or whatnot, because if the feds aren't going to pay the bills, then why should we be following these kind of rules and whatnot, right? He who pays the piper plays the tune, or whatever that, that saying is, or whatever. But you can see where the provinces are frustrated. So the feds actually have to put the money into this program to make it work. And what really bothers me is that they treat the unions as like they're the enemy, right? The nurses unions, the workers and QP and whatnot. They're not, they're just trying to make a system work better. But in the context of employer-employee relationships and bargaining and whatnot, things get put into a very win-lose, zero-sum game, very adversarial, when actually what the unions are trying to do is point out the problems. And Pauline has already mentioned long-term care. How many W5 documentaries does my 92-year-old mother have to see? She is terrified. She lives with us. We're so worried about long-term care in New Brunswick that she now lives in our house, right? Because it's just so scary for people, right? So the feds have to put some money in. There has to be stable funding. None of this, Pauline already mentioned pilot projects and all this kind of stuff. No, that doesn't work. And you have all these smaller organizations spending half their time applying for grants, sinking money into all the consultants to help them write the proposals to get a few dollars here and there. No, we need stable, long-term funding for this and recognize it for the priority that is. Like I said, I'm a foolish optimist. COVID better have taught us all that lesson, because I don't know what else we could possibly be waiting for. Because although the system has got cracks in it and there are challenges and whatnot, there is no doubt that thousands of lives have been saved the last 2.5 years because we've had universal access to healthcare in this country.
Mm-hmm.
So,
Yeah.
I'm just going to take a question out of the chat, which is from Linda Silas, who is with the Canadian Federation of Nurses Unions and a friend of the CHC, obviously. She says, to add to Stephen Staples' promo, after the COF, the annual meeting of the premiers, July 10th to 12th, on the agenda will be healthcare and the healthcare crisis. The nurses unions will be launching a campaign to push the federal government at the table with dollars and a plan. And I'm glad to see that Linda has added that, because Pauline will also be at the meeting of the Council of the Federation, as it's called, where the premiers are going to have to deal with the fact that this recent poll says that the public has dropped in its confidence about the way the provinces have administered healthcare of late. And I wondered if you wanted to maybe comment on that, Pauline and Nicole, because I think healthcare will be very high up. If it's not going to be number one on the agenda, I'll be surprised. And then we're going to try and get a foot in the door, and that could be a good opportunity for us to get this position out, I would think. I don't know.
Yeah, indeed. I agree with what Nicole said a minute ago about stable, predictable funding. And then on the other side, on the receiving side, the provinces have to adhere to strict reporting mechanisms about where they're spending the dollars. They can't just be going out and buying lawnmowers, as we heard, some money that was misspent in the past, when the federal government was giving big chunks of money to healthcare and it was spent on lawnmowers. We can't have that. That's just not on. It needs to go to direct patient care or programs that support direct patient care and the people that deliver those programs. So I couldn't agree more with what Nicole said about the stable, predictable federal funding, and it has to be adhered to as far as the reporting mechanisms go. So, and I also want to give a little shout out to the Yukon. They were the very last to sign up for the national Medicare program, and they signed up in 1972. We talked a lot about the provinces and not too much about the territories and the Yukon. So I thought I'd better give a shout out so everybody feels included and not forgotten.
Can I just jump in again? Sorry, I just what Pauline has said made me think, of course, enforcement of the Canada Health Act. The federal government, never mind being derelict on how much money they've put into it, the oversight has been lacking. We've got an example here in New Brunswick of a reproductive health clinic, Clinic 554. It has made the national media more times than I can count. It's now closed, but we're supposed to have access to services here. It should be portable, it should be universal, it should be comprehensive. And the provincial government here has just absolutely violated the Canada Health Act. And the federal government said, well, we're going to fine you a few tens of thousands of dollars, which they then reneged on because of COVID. That's not enforcing the Canada Health Act. So the federal government has been very weak about enforcing the Canada Health Act. They say that, well, it's a decentralized country. We don't want to tread on provincial jurisdiction and whatnot. This is shared jurisdiction. This is shared cost. The federal government has to play a more active role to avoid the lawnmower purchases. I never heard that one before, Pauline, but yeah, that's not a good expenditure of health tax dollars.
So we'll see how Linda and Pauline and others, make themselves heard at the conference in Victoria. I'm wondering how we can use the tool of the Canadian Health Coalition to underline the importance of this kind of issue. Like, that's the challenge that Stephen and I and Tracy are trying to, juggle in conjunction with all of you. So we hope to work more closely together and use this CASA space as an opportunity to push ahead on pharmacare and on human resources, which is obviously, I think Pauline speaks for a lot of people when she talks about the stress and distress of staff. So I'm wondering, I think we're coming close to the end of our schedule. Pick a couple more questions and then we'll try and wrap things up. I'm wondering, Nicole, what do you see as being the place where we can get leverage immediately? What issue do you think we could use most advantageously to advance some of these constructive criticisms that we've just heard? Like, I'm now talking about strategy and tactics, and I've gone right off the agenda, and I'm asking this question as myself, as an activist and a supporter of the healthcare system. Like, what would be the most effective way to move ahead as a group, as the Canadian Health Coalition, representing all of these different interests and the best interests of the citizens of our country?
Well, to be honest, educating people, and I guess I'm a constitutional historian who specializes in federalism, so I gotta wave the flag here for my profession here for a minute. But a lot of people don't know these stories, and as soon as they do, they start to realize that the federal government used to put a lot more money into this, right? The austerity thing that's not always how it was, right? Or that a lot of political will can align on various axes, right? And things are not just inevitable. Things can change direction and whatnot. So I think again, COVID, we've had a lot of time to sit around the last couple of years and think about our health, think about public health, think about the leadership that has been shown by the chief medical officers of health in this country, or actually think about how some of that's been politicized to our detriment. So we have to start thinking and depoliticizing healthcare in this country for the greater good and not let the politicians play games with it. So I think, paying attention, learning, I guess, reading about these issues, go watch part 2 of the doctor's strike in Saskatchewan YouTube video. Like, it's great. It's in like 6 minutes. It's really well done or whatever. Tell people about these things. tell people to get involved with organizations like this. And when you start asking more educated questions of your politicians, they have to actually start responding, right? And we got a little bit of movement here on Clinic 554 in New Brunswick because people got more educated about the issue and started to really push their representatives about it. And that fight is not over, even though the place is closed. But there's such an educated and active group of people who've come together over that issue in Fredericton and surrounding area that something's going to move on that. It just has to. So again, I guess I'm, as a professor, going to have to say knowledge is power. And the more sessions like this, and I really like to thank the Canadian Health Coalition and specifically Tracy Glenn, who I know through various activities here in Fredericton. She never loses faith. She's indefatigable. She's got more energy than any of us, and I'm so glad to see she's working for CHC. And events like this are absolutely wonderful. And through social media, this video will go out, and people, if they're interested, will learn more. If they disagree with me, I'm sure I will hear from people. That'll be great too. And to continue to engage in these really important conversations, because it's actually the future of our country that's at stake, right? And what we're seeing in the US is pretty scary. And so we have to be vigilant and engaged and educated. And this organization really helps with that.
I couldn't agree more, Nicole. And I just want to add 2 cents worth to that by saying, I too am an eternal optimist and rose-colored glasses and all of that. But if we take a look at the most recent past, we were able to get childcare. How did we get it? We got it province by province. We're working on dental care right now. How do we get it? Province by province. In the 60s, how did we get Medicare? It was province by province. So if you know of a friendly province that would like to have pharmacare, and let us know at the Canadian Health Coalition, and we will go after those politicians like a dog with a bone, because the issue of pharmacare crosses all party lines, just like a national Medicare program did. And case in point was a number of years ago when we pitched an idea, the nurses pitched an idea at the Council Federation meeting, and we had the NDP agreeing with the Conservatives, agreeing with the Liberals that what we need is a pharmacare plan. Unfortunately, that was back in 2003, and we're still working on it. So, you know, as far as this Canadian Health Coalition is concerned, this is the ultimate time in history over the next 3 years that we're going to need support from fantastic people like the people on this webinar to push this over the finish line. We are so close. We have a blueprint. We have Dr. Hoskins' blueprint that the Liberals petitioned him to put together for them. All we need to do is press that go button. And what we need to do it is people power. And you guys are the people power we need.
And on that inspirational note from our chair of the Canadian Health Coalition, I think we're going to close off the proceedings with a few words from Steve Staples. But I just wanted to say thank you so much to Tracy Glynn for suggesting that we do this, to Nicole O'Byrne for jumping on and bringing us all that great historical material. Like, I found that absolutely fascinating. I'd love to see more and hear more. And to thank Pauline, obviously, for her dedication and her rose-colored glasses and optimism, and all of you for joining us. It's been really lovely. And I think we're going to have to do more of these. And if you have ideas for subjects and people that we should bring in, please do pass them on to us, because we want to make this a living, breathing movement, and we want to push forward on this during this CASA opportunity, this moment in time, which emulates what we saw all those decades ago. So thanks once again, and I'm going to give it to Steve to close off.
Well, thank you, Anne. Fantastic hosting. I also just want to recognize a few people who joined us tonight, including some former board members. Marie Clark Walker, who joined us formerly from the Canadian Labour Congress, as well as Barb Byers, who's also a former board member and from the Canadian Labour Congress and is now chair of the Saskatchewan Health Coalition, and their staffer, Juliette Bouchy, joined us as well. Also, many of our allied organizations were here, and I want to give a shout out to Melanie Bichard, who's the chair of Canadian Doctors for Medicare. Always want to point out that many doctors stayed in Saskatchewan. You had many doctors come from the UK, as we saw there. And Canadian Doctors for Medicare are good allies of ours that have fought against privatization, and other doctors like Brian Day in that famous Clint case in BC. So shout out to them as well. And thanks to everyone for joining us. We'll be posting the video online so you can catch it again and share it with your friends on the newsletter on Wednesday. So don't forget to sign up on the on healthcoalition.ca so that you'll get the link when it comes out on Wednesday, as well as some updated news. I think that's it. Anything else?
Merci à tout le monde. Merci à tous et toutes.
Enjoy
Big
the
West.
celebrations on July 1st.
Take care.
Bye.
Until next time.
Celebrate Medicare.